Hi, my name is Piers Blombery. I'm a molecular haematologist at Peter MacCallum Cancer Centre. I work in the aggressive lymphoma service, and I also run the Molecular Haematology Laboratory. I'm responsible for the personalised genomic medicine at Peter MacCallum Cancer Centre for patients with blood cancer. Basically, what we do is we sequence people's DNA looking for mutations which might affect their cancer treatment. So if we take the example of CLL, a type of leukemia, for example, we used to treat everyone the same way, regardless of what mutations they had, or we just gave it one label as CLL. But now we know that CLL is in fact probably 3 or 4 different diseases at least. Some patients respond very well to conventional chemotherapy. Some patients don't respond at all to chemotherapy, and we can really dissect who that's going to be through genomic sequencing. And so the aim is to do the testing on patients with CLL and work out who's going to be in which group, and then treat them accordingly. So we both don't give ineffective treatment for patients, and we give the most effective treatment for them. That's one aspect of how we tailor it, and that is not just CLL. That occurs for acute myeloid leukemia and essentially all blood cancers at this point. So Snowdome and the Wilson Centre for Blood Cancer Genomics have basically provided almost $10 million worth of funding to this aim of curing patients with blood cancer and providing precision therapy. And it's really been transformative for patients with blood cancer. We've essentially got now unprecedented access to sequencing technologies and testing, which is really only available, uniquely in a few places worldwide, and through the Wilson Centre and Snowdome and Peter Mac. That's one of them. So the Wilson Centre also has a research arm which investigates new findings in blood cancer to try and understand which therapies we should be using, why people become resistant to therapies, and also investigating new technologies which allow these results to be got more quickly and more efficiently to patients. Ultimately, we want all patients to be cured of blood cancer, and that's our ultimate aim. That's only going to be achieved through a mixture of clinical trials, getting new agents, and understanding how to use those agents, and on which patients. There's no point having a really great medication if you're not giving it to the right patient. I really can't overstate the importance of the Wilson Centre and Snowdome funding in order to allow patients and facilitate access to this groundbreaking research and treatment.